Erectile dysfunction or impotence refers to difficulty in getting or sustaining an erection which is firm enough for sex. The primary reason for erectile dysfunction is low blood flow to penis, which can happen as a result of cardiovascular diseases like hypertension, atherosclerosis, or neuropathy associated with diabetes mellitus. In fact, erectile dysfunction can be a warning sign for atherosclerosis or clogged arteries. The reason is that penile artery, which supplies blood to penis, is much more smaller in size than coronary artery, which supplies blood to heart. As a result, they are clogged first and can be a warning sign for coronary heart diseases. Other reasons for erectile dysfunction include depression, stress, as well as spinal cord injury and stroke. Erectile dysfunction is different from other sexual dysfunction diseases like ejaculation issues and low libido, which can be as a result of low testosterone level. Treatment of erectile dysfunction include both non-drug measures as well as drug measures. Non-drug measures such as lifestyle modification by decrease in weight, quitting tobacco, and alcohol is helpful. Some men can be helped by having vacuum erection devices, implants, as well as surgery. Natural products which can be used for the management of erectile dysfunction include the use of L-arginine. L-arginine is basically an amino acid which is converted inside the body to nitric oxide. Nitric oxide is important for erectile function because it helps in improving the blood flow to penis as well as erection. Similarly, pycnogenol helps in conversion of L-arginine to nitric oxide, and both of them can be used together. Similarly, ginseng is another natural product, and according to Natural Medicine Database, it is effective. Ginseng causes erectile dysfunction treatment by triggering erection mediated by relaxation of smooth muscles. When it relaxes smooth muscle, there is increase in blood flow to penis and it causes erection. Similarly, yohimbine is another natural product. However, there is insufficient evidence that it can be used in the management of erectile dysfunction. Ginseng can cause risk of bleeding, while yohimbine have significant GIT side effects. Similarly, non-drug measures include avoiding those drugs which can be a cause of erectile dysfunction. These include the use of antidepressants like SSRI and SNRI. SSRI increases the level of serotonin, and serotonin in turn decreases the sexual desire or libido because serotonin directly reduces sensation in the reproductive system. Moreover, it inhibits the production of nitric oxide. Alternative options include the use of agents like bupropion because it is agonist of 5-HT1A receptor and increases the level of dopamine and hence increases sexual desire and has no side effects like SSRI and SNRI. Moreover, agents like antipsychotics can cause erectile dysfunction because they decreases the libido, impair arousal as well as orgasm. Similarly, they also causes cholinergic receptor antagonism and as a result decreases the peripheral vasodilation and blood flow. Agents like clozapine and quetiapine or olanzapine can be used. Similarly, agents like beta blockers and drugs used in benign prostate hyperplasia can also be a cause of erectile dysfunction and should be used with caution or can be switched to alternative medications. Approved drugs for erectile dysfunction management include phosphodiesterase 5 inhibitors as well as alprostadil. Phosphodiesterase 5 inhibitors produces its action by enhancing blood flow to penis as well as maintaining erection for a longer period of time. During sexual arousal, there is release of nitric oxide which increases cyclic guanosine monophosphate. This cyclic guanosine monophosphate in turn causes the relaxation of smooth muscles which is present at the surface of penis, which are basically corpora cavernosa. These are two spongy tubular vessels which runs down the penis. When they are relaxed, there is an increase in blood flow, and the increase in blood flow causes penis erection. Usually, this cyclic GMP is metabolized by phosphodiesterase 5. However, phosphodiesterase 5 inhibitors block this enzyme from its action. As a result, the cyclic GMP level rises for a longer period of time, followed by smooth muscle relaxation, increase in blood flow, and prolonged erection. Drugs which belong to this class include sildenafil, tadalafil, vardenafil, with the usual recommended starting dose from 50 to 100, 10 to 20, and 10 to 20 mg. Some famous brands of these agents include Viagra, Cialis, and Levitra. These agents should be generally taken at least an hour before sexual activity. Sildenafil and vardenafil absorption is influenced by food and should be taken on empty stomach for maximum efficacy. Side effects which caused by these agents include hypotension because of smooth muscle relaxation and decrease in blood pressure. Moreover, it causes a less common side effects like priapism, which is a medical emergency where erection lasts more than 4 hours. Headache is most common and is basically a cluster type of headache, which affects one side of the head and can be managed by using naproxen. Similarly, flushing, dizziness, and dyspepsia is common because the stomach contents go back or upward as a result of esophageal sphincter relaxation. Tadalafil is particularly associated with back pain. Moreover, hearing loss and impaired color discrimination are less common. Phosphodiesterase 5 inhibitors dose should be decreased by 50% in certain conditions. Usual starting dose is 50, 10, and 10 mg, which is decreased by half in conditions like when the age is more or equal to 65 years, or the patient is on certain medications or agents which are strong CYP3A4 inhibitors. These agents include grapefruit juice or antifungal agents or protease inhibitors. As a result, they increases the level of PDE5 inhibitors. Moreover, in case of severe renal or liver impairment, the dose should be decreased. Some of the major drug interaction of PDE5 inhibitors include its concomitant use with nitrates. Since both these agents cause a vasodilation, therefore there would be a severe hypotension. As a result, both these agents should not be used in combination. If patient already took phosphodiesterase 5 inhibitors and later on develop angina, then instead of using nitrates, it's better to use alternative agents like beta blockers. And there is a need to wait for at least 48 hours after taking tadalafil, 24 for sildenafil, and 12 for evenafil if there is a need to use nitrates. Moreover, if patient is already on nitrates, which are long-acting and need phosphodiesterase 5 inhibitors, then it should be contraindicated and another agents such as alprostadil can be used. Moreover, alpha blockers and phosphodiesterase 5 inhibitors should be used with caution. Similarly, strong CYP3A4 inhibitors and phosphodiesterase 5 inhibitors should be used. However, the dose should be adjusted accordingly. If a patient is unable to take phosphodiesterase 5 inhibitors, then the last option would be use of alprostadil. Alprostadil is basically a prostaglandin E1 analog, which is basically a vasodilator. It improves the blood flow to cavernosal arteries, which in turn causes penis enlargement and erection. It comes in injectable formulation and is inserted into the penis with a dose of 1.25 to 2.5 microgram. It produces its action within 5 minutes, which lasts for approximately 1 hour. Similarly, alprostadil, another formulation is urethral pellets, which is inserted into the urethra with a usual dose of 125 to 250 microgram. Both these alprostadil injectables and urethral pellets are painful, and injectables should not be used more than thrice in a week, while urethral pellets maximum twice in a day. Side effects include pain as well as priapism. In summary, Erectile dysfunction is basically a poor blood flow to penis and can be a warning sign of cardiovascular issues. It can be managed by both non-drug and drug options, with phosphodiesterase 5 inhibitors as the major stay of treatment. Similarly, the dose should be adjusted in certain conditions, while the major drug interaction include its use with nitrates. Similarly, alprostadil is the last resort when a patient is unable to use phosphodiesterase 5 inhibitors. Some of the references from which this video presentation is made include the following. If you like this video, kindly share and subscribe. Thank you.